Happy Labor Day, and welcome to another Medical Mondays. Tonight, we have our amazing Dr. Ashby, who I'll introduce in a few minutes, coming back to teach us how to maintain our health with diet and good lifestyle. I'm Dr. Toyin Okwesomi, a family practitioner, HIV specialist who also treats addiction. And I practice in Maryland, all across Maryland, in underserved areas to help bridge health disparities and provide care for those that are needy. Tonight, I'm introducing Dr. Ashby, who is an internist and also boarded in lifestyle medicine out of Yale. She's going to talk to us tonight about how to maintain good health by curing heart disease or preventing it with diet. So, Dr. Ashby, you have the floor. Welcome.
Thanks, Dr. O, and thank you to everyone who's here today. I'm happy to share a few slides on reversing heart disease with food. It's always nice when we can reverse a condition with something that's so benign as food. I'm going to share my slides and go through them quickly because I know the discussion and the question and answer is the best part of this. So let's see if I can share my slides. Okay, so this is a very important topic as it's the #1 killer in the United States and worldwide. And I'm looking forward to a conversation about it because in the last 20 years, our understanding and approach to heart disease has really taken a 180 revolution. This used to be something that we thought was unavoidable and deadly chronic disease. That we just stented open or intervened upon, but still progressed. Now, there are many respected individuals within the medical community who are proving through research that the #1 killer in the world is completely avoidable and reversible. I say food-borne illness here, as you will see throughout the presentation, that the underlying risk factor for this has to do with inflammation born out of poor diet. So thanks again for welcoming me, and I look forward to learning from you after sharing these slides. This is to enrich and share so we can help each other with knowledge and not to diagnose and treat individually. Lifestyle medicine, as you will hear more about in the coming decades, is an emerging subspecialty of medicine that focuses on using lifestyle as therapy and treatment, primarily nutrition, exercise, avoiding toxins, managing stress, which is a major factor in us having poor behavior like poor nutrition and poor exercise, addressing sleep, which is at the backbone of wellness, and connecting interpersonally, which helps with health as well. So I was born and raised in Haiti. I've been in health my entire life. My maternal grandmother was a village healer, and I've always known that I would be a healer. And so this is just continuing the path for me. I was a registered nurse before I became a doctor, and my role in helping patients really hasn't changed. It's the same energy that is that's evolving. So today we're going to discuss what is heart disease, the basic definition, what drives it, what's causing it, so that we can discuss how to reverse it. And as you can already tell, since we're reversing it with lifestyle, it's probably going to be mostly caused by lifestyle. So heart disease right now is a compilation of complications from narrowing of arteries, primarily in the heart, that is from either cholesterol that turns into plaque deposition or cholesterol that is inflamed and ruptures abruptly, causing a blockage, which is when the heart attack happens. And if this happens in the brain vessels, it's a stroke. And when it happens in the legs, it's peripheral vascular disease, but the same physiology throughout. The world's leading cause of death, cardiovascular disease. As you can see on the slide to the right, even as recently as 2019, ischemic heart disease was still the #1 killer. So in the US, that translates to about 600,000 deaths a year, which is a quarter of all the deaths accounted for. When we compare that to the age of COVID, which we are in now, heart disease is still the background silent killer. So this graph is recently from 2000 to 2001, showing the COVID deaths at about 300,000 at the time, and deaths from heart disease doubling that. I mentioned different arteries can be affected, and currently our modalities to treat the blockages that happen is basically, it's life-saving, but at some point I think we'll look back and see that this is very rudimentary. It's going in and blowing up the plaque against the wall of the blood vessels, and sometimes leaving a stent, which is basically the blow-up material to allow blood flow to pass and maintain the patency of that blood vessel. This is a cross-section of a blood vessel. This one here is nice and clean, normal. And over time, the lumen has been basically reduced to nothing as plaque accumulates underneath the lining of the blood vessel. So let's talk about that lining. It's called the endothelial lining. It is 1 cell thick. So you can imagine how easily it can get damaged by inflammatory cells, by cholesterol that have certain hooks on them that we'll talk about, like the lipoprotein that can damage that lining. That lining is extremely important as it produces nitric oxide, which many of you must know, nitric oxide is something that we want in our blood vessels because it dilates blood vessels, giving them the full circulation power that it needs. And when we're under high stress, exercising, we want the blood flow to come, we want the vessels to dilate. And of course, it also prevents things like strokes when the blood vessels are too stiff and can't produce nitric oxide. So cholesterol can get underneath that lining, that endothelial lining. When it goes underneath, it starts to accumulate. When it stabilizes there, that's called a stable plaque. And then when that thin lining there has an inflammation and ruptures, that's when the acute event happens, which is the heart attack or the stroke. So local inflammation at the endothelium is a key issue for heart disease, and also a key issue for allowing cholesterol deposition that leads to plaque formation. Cholesterol deposition used to be what we thought caused all of heart disease. We know better now that there are many other things that play, including inflammation. So this is another view of that same blood vessel with the endothelial lining, showing you here how underneath the deposition happens. This thin layer gets pushed away until it is eventually broken. Sometimes even what's inside that's caused inflammation comes out, and thereby attracting platelets to clog up that little mistake. The platelets then clog the entire artery lumen. So traditionally, we always knew that cholesterol played a role, and that's still the case, even though there are other emerging risk factors. And this is a graph just showing that as total cholesterol increases, so does the risk of cardiovascular disease. So we can't always just ignore the cholesterol. We would like it to be under 200. The HDL, which is the good cholesterol, traditionally helps us clear our blood vessels of other cholesterol. You want more of that. The bad cholesterol, that can get oxidized, which then is like a piece of metal becoming rusted. And that oxidation that happens to LDL is what causes inflammation. So you want that cholesterol to be low in your body. And the triglycerides are also an issue with metabolic syndrome, and that should be low. So in general, a third of the population has high cholesterol. And this is why when people show up in the hospital with a heart attack, about half of them don't even have high cholesterol, yet they're there with a heart attack. So there are other factors, but a third of adults with high cholesterol are at risk. The goal LDL is between 50 to 70. And so that's from studies that show the lowest risk populations having LDLs less than 70. If your LDL is less than 70, assuming there are no genetic risk factors, you could be okay. But if the LDL is under 70, just make sure there's no inflammation or other factors. So the other factors are obesity, diabetes, high blood pressure, of course, smoking, which oxidizes a lot of things in the body, sedentary lifestyle, diet, and stress. So inflammation over the last 10 years has become one of the culprits of inflammatory or cardiovascular disease. And there is a school of thought within cardiology that suggests that it's the primary factor. And so this is something important to keep in mind when you have a normal cholesterol and you have family history of heart disease. You may not know the entire story. We're understanding now that chronic inflammation, which is something that can be measured, is found with many other conditions, including cancers, obviously diabetes, neurological conditions like Alzheimer's, which is being called type 3 diabetes now, metabolic disorders, and of course, cardiovascular disease, which we're talking about today. How does inflammation cause heart disease? You heard me discuss the LDL that we don't want too high, especially when it's, quote, oxidized. When it's oxidized, it can damage that one cell lining of the endothelium, which is the inner lining of the blood vessel. And it's the reason why inflammation can interact with that endothelium. The LDL can be oxidized and then can act as an agent that attracts other cells like the macrophages, which then can begin to create a condition where plaque becomes unstable, allowing for extravasation of that plaque through the lining. And once that happens, then platelets come in and you get a blood clot that closes that vessel. So we know already that stable plaque isn't the issue. It's this rupture of the lining of the endothelium that exposes the plaque to the blood. That's the issue. When I see someone who wants to know about their risk of heart disease, the basic cholesterol panel is the least of my help in determining their risk. The basic cholesterol panel essentially tells us if there are many red flags, but then to look at the big picture, you need to know things like your inflammation status, which can be measured, the number of LDL particles that you have, which can be measured, the amount of oxidized LDL that you already have, which gives you an activity level of your inflammatory state in terms of the cholesterol being dangerous to you. Lipoproteins that actually are part of the cholesterol. Some people have higher levels of them, like ApoB. This happened to someone who used to be a coach on The Biggest Loser, that TV show. And he was very fit. He had a massive heart attack. It was a surprise all over the news. His cholesterol wasn't, quote, awful, but he had high ApoB, which is something that can be measured, but is traditionally not measured in most doctors' offices. Lp(a) is another one that portends very high risk for having events. If there is a sort of normal, little highish cholesterol, these two can be very bad surprises. Myeloperoxidase is another thing that measures active endothelial dysfunction. So when that endothelium starts to get disrupted with inflammation or damage, that can be measured because cells show up and they release this enzyme, myeloperoxidase, which then can be measured. And a lot of people who show up in the ER with active chest pain and don't have positive troponins, their EKG is normal, and they're sent home because nothing was found. Guess what? A lot of them have high myeloperoxidase that was never checked. And they end up having events at 6 months to a year from showing up in the ER. So there's a lot of things that, fortunately, preventive cardiologists and prevention doctors have been doing for decades that are at our fingertips to help patients, but unfortunately it's not mainstream care right now. TMAO is a toxin produced by the gut that can also increase cardiovascular events, insulin resistance, which can accelerate not only chronic conditions, diabetes, but heart disease, can be measured and altered. And of course, nutritional status has a role to play in cardiovascular disease. So this is a pictorial version of that, where you see up here, as we begin to accumulate more plaque that can then rupture and cause a clot or heart attack, along the line of this physiology are all of the biochemical markers that can actually be tested right now. But most of the time, we wait until the person's clogged up and we check our troponins, which are going to be positive, and too late. Over here are all of the opportunities, sometimes even years prior to the event, that can be checked so that heart disease can be reversed. So this inflammation that's at the root of heart disease, what causes it? It's very basic. Inflammation so far is thought to be caused by stress, sometimes chronic conditions like autoimmunity. We are learning now that visceral fat, that visceral adipose tissue, is a pro-inflammatory organ. So poor diet, which leads to accumulation of visceral, which is fat inside the organs, it has a hormonal action on our immune system and on our metabolic system, and visceral fat is known as a pro-inflammatory organ right now. Smoking, autoimmune diseases, and lack of sleep all cause chronic inflammation. You can check HSCRP in people and regular CRP and find it high, and you can bring it back to one of these events. So chronic inflammation can then lead to weight issues, which we talked about, and then those can lead to heart disease and a lot of other conditions. And today, we'll talk about some of those foods. Pro-inflammatory foods are found to be highly processed, sugary, refined carbohydrates, man-made items, primarily processed foods. Obviously, these are already linked to obesity, which then will be associated with visceral fat increase, which then will create an environment of inflammation. So this is Dr. Esselstyn, who's been one of the leaders in preventive cardiology. He is right now the director of cardiovascular prevention at the Cleveland Clinic. And he went even further to include things like fish, oil, meat, dairy, caffeinated beverages. He's one of those individuals who actually is continuing to conduct studies on now over 1,000 patients whose disease he has actually reversed and published. And I'll share that with you shortly. So olive, palm oils, surprise, they have been shown to cause endothelial dysfunction. If there isn't a degree of heart disease in that person, they want to take palm oil, okay, but for those who actually have documented advanced disease, it gives them an idea of how strict they can be with their diet to see results. So there are many studies that show that the standard American diet obviously is pro-inflammatory, but some studies actually assign about half of all deaths from heart disease and stroke to the standard American diet, not to mention type 2 diabetes. And on an individual level, as well as on a countrywide level, the World Heart Federation had this statement about globalized food system being a source of chronic cardiovascular disease. So poor nutrition, what's happening? We're causing inflammation, which is then leading to heart disease and death. Number one cause of death is basically eating ourselves to death. So the sad consequences of poor diet. So when I was graduating and finishing up residency, I couldn't utter words like reverse heart disease and reverse diabetes. Now it's definitely not only legit, but okay. And there's a whole field of medicine that's with me on this. This is Dean Ornish. He's one of the forefathers of lifestyle medicine, and he's been studying this particular issue in heart disease reversal since the early 90s. And he published in the Lancet a study that showed reversal of heart disease by angiography with lifestyle. He used a very low-fat vegetarian diet, stress management, and movement, 4 of the pillars of lifestyle medicine right now, and is able to help his patients with this. This is the original study that was published in the Lancet by Dean Ornish, a cardiologist, and this was in July 1990. So he's since written another book, and as I go through these slides, feel free to sort of snapshot them because I know there will be a lot of books. This is another one that he actually wrote recently on how to undo it yourself, which can be done. So lifestyle medicine has the 6 tenets, and Dr. Ornish's program, in addition to avoiding toxic foods and going by a whole grain diet, his program has a stress management component, a psychosocial, sort of a social connection component, as well as moderate aerobic activity. Our local hospital in Sarasota actually offers it, and it is covered by Medicare, the whole program, which is about $600. So the Ornish Reversal Program is the first integrative lifestyle program for reversing heart disease and other chronic condition that Medicare is now paying for. And they pay for it as part of an intensive cardiac rehab program. So if you think you might qualify and you want to go through the program and you have Medicare, there are options for you with this program. Dr. Esselstyn, who I introduced a little bit earlier, who's at the Cleveland Clinic, also publishes his studies and has a program that he's written about, and you can read it or download the book and go through it yourself with your physician. His is basically a whole food plant-based diet as well, a lot stricter. The patients that come to him have had heart attacks, have had stents on many medications, and basically have no room, no wiggle room left. And so his is a very strict program that sees reversal as well. This angiogram is from one of his published patient studies where the heart disease that you can see here, this is one of the coronary arteries. It should be this thick, allowing blood flow, but you can see it thins out here. You can only see the blood flow going through a small opening, and this is after the dietary lifestyle change. This is what we call reversal of heart disease. The lumen of the arteries actually remains patent again. It reverts back to having more blood flow. So we can now say reversal of heart disease without fearing repercussions. Thank goodness, because a lot of people need this. It does take a while for some people who have significant disease. This is a picture of a man who had 80% blockage. And over time, you can see the body actually heals itself if you stop poisoning it and if you continue to promote healing by eating good foods. So the patients who opted to follow the diet had a 99.4% success rate in Dr. Esselstyn's study. He included basically a lot of plants, fruits, vegetables, legumes, grains, and green leafy vegetables made the base of the pyramid for his recommendation. I'm sharing with you a couple more studies about foods reversing heart disease. This is the portfolio diet that was also published in the early 2000s. It used the whole grain, fruits, vegetables. This one did allow healthy oils, nuts, and seeds. It was published in 2007, 2009, compiled in this book, which is the Portfolio Diet for Cardiovascular Disease Risk Reduction. They basically wanted to know, is the diet as good as a statin? So the control group had a low saturated fat, and the intensive group was on their portfolio diet that was a little bit more consciously decided on what they would eat. And each group had their bad cholesterol measured at 0 and 6 months. And this is the actual study published in JAMA in 2011, a randomized controlled trial, which is the highest level of evidence that we can have. They compared this particular diet to lovastatin 20 milligrams, which is a low dose statin that some people might get to lower the LDL by 30%. Well, the diet lowered LDL by 28.6%, and statistically, there was no difference between the two. So if you want a 30% drop in your cholesterol, LDL in particular, you adopt a portfolio diet, you can get the effect of the same statin. the China study, this came up in the early 2000s as well. This is a physician, T. Colin Campbell, and his son, who both wrote about the benefits of a vegan diet. And this was published in 2005. And if you need a book to get you started on the effects of nutrition and how a food system became the source of our chronic diseases, this is the book that I would start with. A few others just to show you that it doesn't have to be so strict. Dr. Pam Popper allows some organic animal foods 2 times a week, and her patients do great. She allows some high-fat plant foods, nuts, seeds, olive oil, and a lot of water. And the base is made up of legumes. Dr. Joe Furman, again, these are bestsellers, and rarely allowing beef, sweets, cheese, milk, but the diets have to be chosen based on the degree of disease that the patient has. All of them have in common that the main thing that would make up the diet would be vegetables, fruits, beans, and legumes. Dr. Furman focuses on having a diet that is nutrient dense. You know, eating the same spinach for a year probably won't get you all the nutrients you need. And at the end of the year, there might be many nutritional deficiencies. So his stance is really to make sure that the vegan or vegetarian diet that you choose is well balanced and nutritious and promotes health. So reversing heart disease is as easy as stopping the food poisoning. A lot of people are doing it. Whether you go vegan, Mediterranean, primarily plant-based, Ornish style, Esselstyn's book, portfolio diet, there are many, many options, and it can be individualized based on the particular issues that you have, whether it's insulin resistance, or whether there's very high risk of an event, or whether there is an issue with the special proteins like ApoB, Lp(a). All of those can be mitigated with your doctor or with a lifestyle physician or someone who specializes in cardiovascular disease prevention and reversal. So in summary, heart disease, which is our #1 killer globally, and particularly in the developing world, as well, you know, that includes India and other places that are now beginning to get the fast foods that we've been used to here. It could snowball out of control, but it's completely preventable and reversible. LDL, which we thought of as a traditional risk factor, is not the only thing that goes into equation when we consider someone's risk for heart disease. Inflammation, we know now, plays a major role in addition to the entire picture of the patient's particle numbers for cholesterol, their lipoproteins, and other factors that I mentioned. Diet choices can not only reduce cholesterol and inflammation, obviously at the root of those is the cause for heart disease. So diet choice can actually reverse this condition that is gripping the world. And so these are some of the books that were highlighted during this talk, and each of them have a website. I included the last one here, nutritionfacts.org. I didn't mention the physician who started that organization, but if you check it out, it's going to be a really, really helpful site. So I practice lifestyle medicine locally, and I'm very happy to be reversing chronic diseases whenever I get the chance. I'll put my email in the chat, but that's my number, and I'm happy to help if there's anything I can do. I'm very excited because I do see patients occasionally who become my own motivators, and you know, get rid of these chronic conditions. It's possible. Just get yourself disease-free. I live the life as well. We're all in the journey together. Food is medicine. And I'm so thankful to have a cohort, a tribe, you know, in the lifestyle medicine physicians. And I thank you for your attention.
Dr. Ashby, fantastic. Now, were you the one in that last picture, the bodybuilder? Can you bring
Yeah.
Can you bring that picture back, please?
Wow.
That slide.
Oh, yes, actually.
Please bring it back.
If I know how to do it.
There you go.
Go on with your body. Yeah, there
You
you go.
know you know how to do it. That was why I didn't worry about your slides, because you got it. This is fantastic. I have something to live up to.
Well, you know, there are 80-year-olds who look better than this, and they're my motivation.
Thank you so much, because that is directed at me. I need to do this. You know, for everyone at my earshot, I have consulted with Dr. Ashby personally for me. And I'm a physician myself, but if you know anything about medicine in the US, you're not allowed to treat yourself anyway. You have to have your own physician. But Dr. Ashby unveiled things that nobody had caught. And so I have been personally blessed by her. It's why I keep asking her to come back so she can bless a lot more of us than just me. So thank you so much for another phenomenal presentation. And can we
stop sharing?
on? Yes, no, don't. Does anyone want her to stop sharing?
Nope.
Yeah.
No.
Nope.
Look, this is
awesome.
motivation for every one of us here tonight on the screen, that this is doable. You can actually work out and get a body like yours and be healthy. So,
and it's an ongoing process. We change every year, we change every season. We have to consider where we are at the moment and take the next best step. And it's always nice to see someone who's ahead of you, maybe in years and experience, or something that they can offer you that makes you say, oh my goodness, I have something to look up to. So I have that too.
Thank you. And your humility always is so refreshing, heartwarming. Thank you so much. I want to ask you the first question, and if you don't mind, and this is about cholesterol, lipids. There was a lot of hype on cholesterol, which for good reason, after a physician, actually, I think it was 3 physicians died back to back at Johns Hopkins, and they were slim. None of them was obese. One of them actually dropped dead, exercising, jogging, and the common denominator amongst them was high cholesterol. So that caused a lot of hype then. This was years ago, and statin became a standard to reduce cholesterol. But some people are still living with high cholesterol. Again, there are no symptoms.
Right.
You don't have high cholesterol, which is, is a fact of life. You don't get any physical symptom from it. Can you please expatiate on that lipid panel cholesterol that you shared with us and what to do to reduce it, because it's a killer.
Yeah, so, those cases where you have someone apparently healthy, this issue of apparently healthy is a misleading one, because even now in the age of COVID, we have apparently healthy young individuals who are dying. But if you check them, if you actually looked where it matters, you might see that they have high levels of chronic inflammation in the body that predisposes them to have a cytokine storm when they're faced with another condition that accelerates the inflammatory state in the body. Likewise, with those cases of lean athletes having complicating heart disease, there are genetic conditions that can be checked, primarily the Lp(a). The Lp(a) can happen when someone is thin, is an athlete, a vegan, and it's not from lifestyle, and it's very atherogenic. If you look at the makeup of the cholesterol protocol in patients who have that variant, the lipoprotein, a part of the cholesterol that's a protein, almost has a hook that damages the lining of the endothelium that we were looking at. So high levels of Lp(a) is something that can be checked, but is not a typical routine blood work that we do in our, in our primary care practices. The second thing is, if there is familial hypercholesterolemia, if they found the numbers to be very high, it can be, again, a genetic or production issue, and looking at the entire picture can be helpful. In those cases, statins do help. They bring down the total value, the total burden of the cholesterol. I do see some patients with cholesterols of near 300 who have never had an event. And if you look at the biochemical markers that are a bit advanced, their endothelial lining is stable, there's no inflammation happening, they just have high cholesterol. Well, the pattern of the cholesterol is important. There is a pattern B and a pattern A. I didn't go into that because of time, but you can actually look at someone's detailed cholesterol panel and know whether they have large, fluffy, benign cholesterol particles that just bounce off the walls when they circulate, or if most of that 300 total cholesterol is made up of very small, dense LDL particles that are very dangerous to the lining as they move through. So knowing what kind of cholesterol you have is very important, not just the total. And if you have a high total in someone who's not having an event, it could be because they have a very good pattern of cholesterol. They might have pattern A, which is large, fluffy particles. They might have a very healthy, stable lining of the endothelium. They might have no inflammation. They just produce a lot more cholesterol, but it's not what we call atherogenic. It's not dangerous to the vessel. It doesn't lead to plaque formation. It doesn't damage the lining. And this is why a lot of doctors in the prevention space encourage more and more primary care doctors to look at the whole picture, or to send the patient to someone who can, if they really want to assess the real risk. Like you, I've had colleagues who've had patients who had events and they looked fit and they passed their stress test, and it turned out they had high apolipoprotein B, which is a very reversible risk factor for heart disease.
Thank you so much. Appreciate your explanation of that. I have a question here that I'm not sure what it is. And Ms. Agneta, if you can please unmute and ask the question. She's asking questions about what specialists would test for those non-traditional testings that would, give a full picture of what is going on. I think that's what the question is. So if you please unmute and ask it, that would be great.
Hi, good afternoon, everyone. She technically just answered my question in her speech, but my question was, how can we get non-traditional testing done, as your primary care physician wouldn't do it, and it probably wouldn't come up in your general testing? How can you request for it if you don't have any other symptoms, and what specialist would actually conduct that type of testing?
Okay, so, even some cardiologists, colleagues of mine, send me their patients because they've added another stent and they're still having the issues because lifestyle hasn't been addressed. So while some primary care and other doctors could do this, but the time investment in learning how to interpret and do something about it is another question that they have to answer. So usually prevention cardiologists, and unfortunately they're not everywhere. Prevention cardiologists, however, you can be confident they're going to be able to help. And some doctors who have taken it upon themselves to learn these, and the tests are basically advanced cardiometabolic testing that are offered by the Cleveland Heart Lab. And Cleveland has been offering these tests for decades. They have a very robust and evolving prevention cardiology section. And now that Quest has bought Cleveland Heart, anyone around the country has access to these labs, provided their physician will be able to order it for them.
Thank you.
Okay, so we have a lot of education and outreach to do with primary care doctors for sure, and with other lifestyle physicians as well.
Thank you very much. So here I have another question. What early stage is the same? Is Ms. Agneta also asking, what early stage self-identifying symptoms do you have for us that may be a red flag that something may be off?
Okay, it's a good question. You know, we used to talk about symptoms being early. They're not. Symptoms, it's already late. If you're already symptomatic, things have been brewing. So I think my perspective for prevention is a bit different, but I'll tell you the symptoms of an artery closing is the tissue that it feeds not getting enough blood supply. And most tissue, when they don't get enough blood supply, they cause pain. And tissue, if it's muscle and it's not getting enough blood supply, it's usually going to be when it's under exertion. So if there is tissue in the calf that is walking, needing more blood supply, can't get it, you'll get what's called claudication. Basically, walking makes the pain come on, sitting still makes the pain go away. Same thing with the heart, that's called stable angina. You have a closure that's stable, and every time your heart is asking for more blood flow, it can't get it, so the heart tissue pains and cells may be dying. And when that plaque ruptures, it's an acute event. There's no more, it's too late. So for heart disease, I wouldn't wait for symptoms. I say in your 30s and 40s is when you should be getting this type of testing, because 20 years of the standard American diet guarantees you have coronary artery disease. It's just not been closed enough to cause symptoms. It usually happens in, depending on the diet, when you're 60 or 70, the events are happening. But the signs can be checked way before that, before the artery closes, before symptoms begin.
Thank you so much. Prevention, power of prevention. It's very important to prevent than to wait for events to occur. Then what we do is palliate, unless you see Dr. Ashby to see if it can be reversed. So, Dr. Ashby, a lot of people are just appreciating you in here. Somebody said you just look amazing. You're beautiful, and thank you. Commissioner Duyile is here, thanking you for impacting us so wonderfully and so greatly. Sister Lola is here as usual, all just happy to have you here. So somebody asked.
And I also see Mr. Dennis asking, raising his hands.
Oh, you see somebody, okay. Let me ask this question, then I'll get to that person. It says, somebody says they're curious to hear how you approach the removal of oils with your patient. Do you customize based on risk? And I don't understand oils. Do you understand it?
Oils?
Yeah. Removal
yeah,
of
so
oils.
actually, I do customize based on risk. Everything that I do, once I end up seeing a patient, there's no other way around it but to customize it, because you see all the nooks and crannies for that particular patient and their blood work result. So you can know whether the person can withstand oil, whether they can actually have fish, whether they can actually have red meat. All of that is available as information once you have the prototype of the patient in front of you, the data. So if the patient already has this toxin, TMAO, that the gut is producing from exposure to red meat most commonly, you know they can't process red meat. That's out. If the patient has and they're omnivore and they eat meat and they don't want to give it up completely, you can calculate their risk of having a cardiovascular event in the next 10 years. If that calculation shows a low risk and they want to continue eating some meat, I would go to a diet like one of the less strict ones that we talked about that allowed at the very tip of the pyramid, fish 2 to 3 times a week, increase the omega-3s, allow olive oil, allow nuts and seeds. If the patient has events, they really don't have any room if they want to reverse. It's a big if they want to reverse their disease. Currently, what's published, that data shows that no oil in those patients, no meat whatsoever, a vegan diet will help them reverse their disease. And so, yes, it is customizable.
Fantastic. Thank you. Somebody asked, is it rare to not have inflammation as an additional factor in cases of hypercholesterolemia? Also, how significant is MCT?
How significant is MCT?
Yeah, that's
The MCT oil.
Yeah, medium chain triglycerides. I think that's it. But they're asking if it is rare not to have inflammation as an additional factor.
It's not rare.
Hypercholesterolemia.
So patients have high cholesterol without inflammation all the time. So you can see it. It's not uncommon to see that. So this is the case of a patient who actually is producing too much cholesterol, who may be generally healthy in terms of their diet, who may have inherited the apolipoprotein disorders, increased ApoB and increased Lp(a). They may produce a lot more of the small, dense particles that are atherogenic. All of that can be measured, but there might be someone who's not obese, who is not engaging in refined food eating, who does not have underlying inflammation. That can happen. And in that case, you tailor the diet to address the cholesterol, which is their primary driver for their heart disease risk. When there's inflammation as well, it accelerates the heart disease progression. So you not only have to reverse the cholesterol, but you have to reverse what's causing the inflammation first, because that's like the fire that's being fanned. You know, the inflammation fans the fire of the high cholesterol. So it's not weird to see.
Fantastic. So MCT, I think the last time you came, I asked you about that oil, the I think it's medium chain triglycerides that comes from coconut oil. It's refined into MCT oil. And people said it was good. I've not eaten it since the last time we talked.
Well, you know,
avocado oil.
The one thing about lifestyle medicine that I really appreciate is while it allows for all of this lifestyle, which at one point was seen as, you know, not scientific and not worthy, it really is evidence-based practice. So, so far, while there may be anecdotes, if you have heart disease, there isn't yet, besides the statins, a one-shot new oil or new agent. A lot of things can help, and it may be part of the dietary protocol for a person if they think it works for them. But I would take that on an individual basis. It is not one of the top 10 or 12 things that I go for in a patient that has heart disease. Omega-3s are much more important for inflammation reduction and supporting heart, and that's been published. So there are many other things there that are available. Why would you skip over them? Don't skip over the obvious to go for the newest thing.
Great point.
So the data is not there yet, is what I'm saying. And I said the same thing last time. It's really popular right now because the low carb community has a lot of new things available, this being one of them. And low carb is great as a diet approach. But it's less tricks based and more comprehensive good nutrition approach.
Thank you. So Bill, can you please unmute and ask your question?
Yes, okay. There are a couple of questions I have. Thank you, doctor, for bringing this information forward. We really, really, really need it. You were speaking about the MCT, or coconut oil, is a saturated oil, but as you were just saying, it could be a fab item which is coming through right now. I've learned that saturated oils are not oils that we should be using on a regular basis because of basically the saturation. Another point I'd like you to speak to, if you can, of course, is the use of fiber. And one other thing, are people of color predisposed to a higher cholesterol?
Great question. So actually, there is a tribe in Africa, there's an entire region. They have 1% or less cholesterol. So they studied them and their diet, and they determined that it was a combination of their genetics and their diet that give them this. Nobody dies of heart disease there. So I shared their story and that tribe. So the genetics matter when it comes to heart disease, but they haven't nicely fallen in terms of African-American versus non-African-American yet. There are some variations in the dangerous types of Lp(a) that African-Americans can have versus Caucasians, but that's almost splitting hairs when you talk about Lp(a), whether someone might have the dangerous type. If it's high, we don't get to see which type is high. If it's high, we lower it. But there are some studies showing that in the African-American population, that particular atherogenic apolipoprotein is more common in the African-American population. There are a lot of other issues that disproportionately cause cardiovascular disease in the African-American population. And that includes the same conditions that predispose them to more morbidity and mortality from COVID. It's underlying poor health that relates to lifestyle, which someone might relate back to access and food deserts and inflammation from a variety of other sources. And yeah, I agree with you with the MCT oils. I don't even go to that. Like I said, we have so many good options for reversing disease. You didn't see MCT oil on any one of my slides from any of these other doctors who actually study, make this their life. You know, Dr. Esselstyn's been doing this for over 40 years. You know, Dr. Ornish for over, 50 now. And to have Medicare cover his program, so these, they're basic things like nutrition, good wholesome food that can help before we get to the MCT oils. And I think you had a third question in there that I may not be getting at.
Speak to fiber.
Fiber is really important. In the portfolio diet, one of the key ingredients in the success of their diet to equal the effect of a statin was the amount of fiber and the types of fiber that they included in their particular protocol. The portfolio is basically a list of foods that were included in the patient's diet, and fiber was a key component. And you can get into soluble and insoluble and how much per day, but in general, or diet is very low in the total amount of fiber that needs to prevent heart disease. If you double it, it's already helpful, but it's key. I would say that goes way above MCT oil.
Is a fiber like wheat compared to a fiber like oat? Some people have subtle wheat allergies in and of themselves, which creates a condition, and they're taking fiber, but they're still having a reaction. So is it necessary that we now clarify the best fiber to use, or do we just eat properly, steam our vegetables and things in that order? Do we totally change our dietary approach as opposed to trying to find the best fiber, which helps us stay healthy, basically?
Yeah, so I would actually ask whether there seems to be an intolerance to certain foods like wheat. Wheat has been really sort of bastardized in our food environment. There's a lot of contamination that's happened that makes it an allergen to a lot of people that used to tolerate wheat. This issue of gluten sensitivity is now so rampant. It does contribute to inflammation. So if you're taking a food which could be high in fiber, but it's fueling an inflammatory process, it defeats the purpose. There are easy tests to check to see if you have sensitivities like that, if there tends to be intolerances, and even sometimes when there aren't intolerances, but there might be a subtle rash or suspicions because you feel better when you off of that food type of thing. So those are cues that the body gives that I would test. And if it's an item that causes the body to begin the inflammatory process, it's not worth it because, like you said, there are a lot of other options for the fiber.
Yeah. Thank you. Thank you. Thank you. Thank you.
Mhm.
Yeah, thank you.
Thank you for your questions. And now, Mr. Dennis, thank you so much for your patience, sir. Please ask your questions.
Okay. Patients and me are not usually good friends, but I wanted to listen to what you had to say. Thank you very much, Dr. Ashby. I wanted to make a comment. In a book called Living Better Longer by Richard Passwater, he's a PhD. He studied antioxidants since the 60s, and he studied OPC3s, oligomeric proanthocyanidins, since the late 90s. One of the things he said in that book, which really stuck out in my mind when I read it, was he said, if you don't have a balance of antioxidants with the cholesterol gets sticky, sticks to itself, then it starts sticking to the walls, and your macrophages come over, put a foam on it, occludes the vessel, you have a heart attack, you have whatever, depending on where the blood vessel is. But he said, if you have adequate antioxidants, particularly pycnogenol, which is a white pine bark found in southwest France, it keeps those cholesterol molecules slippery so they can't stick together. Have you read anything or come across anything like that before?
Yes, the concept is very familiar because the stickiness that he's described is actually now called oxidation.
Bingo.
Oxidation of the LDL is what makes the LDL stick and damage the endothelial lining. So you could have very large, smooth, bouncy LDL particles without a lot of the protein component, lipoprotein, and they never cause damage even when the number is very high. You could also have very small, tight, dense LDL particles that have a lot of the lipoproteins, which then if they get oxidized in an inflammatory environment, they can cause damage. The oxidation of the LDL is a problem, and that can be measured. Antioxidants of all types are helpful, and they're found in many places in nature, including that bark. One other place is omega-3s. Oftentimes, when there's high inflammation in the body due to poor diet, you'll see low omega-3 in that same person. And omega-3s actually help fight inflammation. So if you help the body with its own ammunition by eating foods that are high in omega-3s, it will then know what to do with it when it comes to the physiology. So yes, the lining of the vessel, you don't want anything sticking to that. And when LDL particles travel with protein sticking out of them and they're oxidized, imagine them like the iron that is rusted, it will cause damage. And so yeah, I'm sure many people before this have written in their own ways about this, and it's nice to have clear direction and definitions that are all agreed upon.
I agree with everything you said about the omega-3s and the antioxidants. Thank you very
And there are
much.
also pro-inflammatory omegas. For example, omega-6, if it's too much in the body, it's often pro-inflammatory. So there needs to be a balance. So the balance is key. And fortunately, we can measure both of those things.
Always, balance is key, always. Yep.
Fantastic. Thank you. Somebody commented that a recent meta-analysis found that coconut oil can increase LDL. You've told us this over and over.
It does. We know that. We know that. So again, if you don't know what type of LDL you carry, with this craze of keto, you go keto because you need to just see your body look different. You will transiently be putting your system at risk if you make the type of atherogenic LDL, because yes, it's documented that any intake of saturated fat, which coconut oil is very high in, will transiently increase your saturated fat. And a lot of people in the keto community say, well, that's okay, the body will figure it out. But in the meantime, anecdotally, there are people who don't have a chance for us to figure it all out, because they might be producing more of the atherogenic type based on their genetics.
So Mr. Bill also said something about relationship between melanin and vitamin D.
It just makes it harder for us to activate our vitamin D. It's a little bit more of a barrier to have melanin. So the more melanated you are, the longer it takes in the sun to have that reaction on the skin that will translate into increased vitamin D levels. The reason why most Black women and Black people in general have complications from COVID is also because they have very low vitamin D level. Vitamin D is not just a vitamin, it's a very active hormone for the immune system. And being caught with low vitamin D, inflammation, chronic disease with a virus that loves to make inflammation worse, shows us why we had such a hard time with underlying diseases and COVID. But we're talking about the heart, and vitamin D plays a role there too. And yes, melanin, I encourage everyone who's melanated and not melanated, even if you live in Florida, almost guaranteed, unless you've been consciously replacing your vitamin D, it's probably low.
Thank you so much for that. And thank you, Mr. Bill, for bringing up vitamin D. Vitamin D is very important, especially in us. And Dr. Ashby, you know that there has been talk that COVID has disproportionately affected people of color, Black people. Now you answered that question. We have melanin that shields us from the sun. We don't get the sun, and so we don't have enough vitamin D. And so that poses to poorer outcome. With COVID, vitamin D is important. Deficiency increases high blood pressure, That's cardiovascular disease. It increases the risk of osteoporosis, you know, multiple sclerosis, constipation, back pain. You know, I've resolved a lot of people's back pain just by having them replace their vitamin D. It's also been linked to, does not cause, but linked to colon cancer, depression, and dementia. It's just it's an important vitamin that we need to take, but not in multivitamin, the vitamin D itself.
Yeah, and a lot of people don't absorb it. Just to mention that the over-the-counter vitamin D replacement, I've seen people take years and years of it and still stay low. We've learned about an absorption cofactor called K2, and it's actually very helpful for people who have very low levels to take the K2 D3. And you can speak to your doctor about this and you know, measure the levels. It should be fixed within 3 or 4 months, not a year.
Yeah. It's actually fixed within 3 months. Yeah, go ahead, Mr. Bill.
In some of the cases, they were using vitamin D to help balance the vitamin C. So it triggers D2, actually D3, helps balance the vitamin C, which is critical in terms of our immune system. I think you spoke to that at some point when I spoke with you last, Dr. C.
Dr. Ashby.
Yeah, Dr. Ashby. So they're now injecting using a vitamin D to build up vitamin C. I'm sorry, calcium. Excuse me, calcium. Speak about calcium.
Yeah, calcium in bone absorption. You know, in terms of COVID, I would say that in our protocols initially, there were a lot of vitamin D and vitamin C given. This was in the setting of inflammation. But when we talk about the bone, calcium, you can take calcium till you're blue in the face, but if the vitamin D is low, it's going to be very hard to get that bone mineralization without the vitamin D. So that's why calcium and vitamin D go together for bone health.
I've heard it put this way, that the K2 with the D3, the K2 is like the traffic cop. He's directing the calcium into the bone to get it out so you don't have excess in the blood vessels.
Thank you so much. I mean, take home, we need to all be taking vitamin D. And Dr. Ashby, can you see in the chat box?
Let me see.
What Mr. Bill wrote at his last sentence.
Oh, what was that? What did I write? I didn't see the last.
Phytogenol is now sold in health food stores.
Oh yeah, pycnogenol, what the gentleman was speaking about from the pine bark. There are studies out there that he actually that have been written some time ago. Actually, it's been around. You know, in the naturopathic community, they are aware of its value in terms of its use. It hasn't gotten much play, you know, as we cross over into mainstream, but it has been around for quite some time. You know, it's one of the, how can I say, one of the items which are out there to be used the proper way, of course. But, you know, again, speak to your doctor, speak to your clinician about how, what, and why to do with it. So, but it's been around a while.
Great, thanks for sharing. And I think, as you said, in the naturopathic world, there are a lot of things that predate conventional medicine that are now being rediscovered sort of and put into the mainstream. And this certainly is one of them. Same thing for red yeast rice in terms of cholesterol. If we're talking about supplementation, that has had some data that is not used by the average doctor So if someone has cholesterol and cannot tolerate a statin or refuses to take a pharmaceutical, there are options. And so thank you for sharing that.
One of the things just outrageous to me is that it was, what is it, the cholesterol entity, you know, that they were now feeding everybody to handle the hypercholesterolemia. That to me was sad, as opposed to speaking to nutrition and helping it bring down first. There was something else that I wanted to add to you, ask you about. The gentleman spoke about, you and the gentleman spoke about the use of the pine bark per se, but doesn't the level of hydration have impact that process that we're speaking about? And so many of us are not drinking enough water and or drinking the wrong water. And that to me, you know, we're selling distilled water as an entity to drink, which is unbelievably crazy, but people are using it as sadly. And then we have heavy water, or D3 water they call, again, and even to the point of buying these waters which are purified, which have a magnesium sulfate, Epsom salt in them. Why? No, to get this information out, we need to do that.
Yeah, I think
Somehow,
water is a very important component, as most of our cells are made up of water, and we really need to go back to the basics. Many people aren't drinking as much as they need to be, if you really look at the amounts that they're taking in. And one of the slides that I share, I think it was Dr. Popper, actually at the bottom of her recommendations is water, mandatory intake. And I don't know if you can see this, but just before you get to her legumes and whole grains, she makes the point of starting with water intake. It's very important because it's something obvious that we skip over to wonder about, you know, specific type of oils, which wouldn't make it until we're up here. So all of this here, opportunity areas that people are skipping over. It may be too simple, it may be too basic, but that's where it's at when it comes to the first steps to reversing heart disease.
That 64-ounce determination was actually came out in the late 40s after the soldiers were coming back from the Second World War. Given our level of pollution, what we've done to the food and everything, shouldn't we exactly be moving higher in terms of our intake of water? Because that was, you know, that's a historical number, which we all know, but it was done in the late 40s.
It's the least that most aren't even doing. I calculate people's calories when I do a personal meal plan. And you can get a scale and take a look at your body water in terms of your body composition. Athletes, depending on where they are in terms of their dryness, water can be manipulated. But again, we're talking about that is not even reached. But if I were talking to you personally and you were aware of that, you know, I would ask you, well, are you getting that? And water is really demanded by the body too. A lot of times people are thirsty, that it's too late. When you're thirsty, those that thirst mechanism is telling you that it's already too late. You waited too long. But I agree with you. There's ideal and there's basic requirements. And I think this is a basic requirement.
Absolutely.
Dr. Ashby, phenomenal. This has just been phenomenal. Thank you so much. We have here tonight, this is amazing. We have Dr. Mike Oye on here. I just spotted him when I was scouting around now, and he's a naturopathic doctor. Can you unmute, sir? and give us a few words of wisdom. Welcome, sir.
Hello.
Hello, sir. Welcome,
Hello,
sir.
doctor.
Dr. Ashby, I've enjoyed your lecture very much and the answers you have given to many questions. I thank God for your experience and your expertise. God bless you. Well, I have just enjoyed sitting and listening carefully. I was really enthused about something about coconut oil. I think we don't need to fear. It's one of the things I have found to be extremely useful. And we don't need to fear about the fact that it is comprised of saturated fatty acids. Those fatty acids are short-chained, and many experiments have already proven that they are more beneficial to the body than people think. I think we have to do more research on coconut oil. The West African coast, for example, has been blessed over centuries by constant taking of coconut oil, either in cooking or raw, or drinking the water, coconut water, or drinking the eating the flesh. The effect on the brain itself is wonderful. Most of the parts are nervines, and they help to repair the nervous system, both gray matter and any other part of the nervous system. And that is very important. In fact, if they test the IQ of many people along the coastal line of West Africa, they will find their IQ to be very high. Gambia particularly is so blessed. It's not only because of the coconut, but it's also because of the vegetables that they eat and the antioxidants, found in all those vegetables and so on. And these things affect the heart.
Yeah, I have to say, anecdotally, I've had patients from different parts of Africa who particularly use palm oil as well as coconut oil.
Okay.
And we test their cholesterol, before it's high, and off the oil, it goes up a little bit more. And we go back on their oil because that's just the way that they grew up, and they'd like to keep that way of eating. And it comes back to the baseline level. So I don't think we have the whole story. I agree with you on that. I think we have studies that show people with clogged arteries, particularly the ones that are having events and are in this society eating this diet, getting better with specific foods. And in particular, the ones that don't include a lot of the saturated fats, because that just came as part of our understanding of what increases cholesterol. But I also agree that in particular with the Alzheimer's studies that are coming out now, thinking of this as an inflammatory condition that is potentially reversible, good fats are one of the ways that the dietary approach to improve Alzheimer's disease is leaning. Yeah. And so they definitely have their benefits, and we have to continue to see how to apply them appropriately.
Mm-hmm.
And in the general population, if there isn't an event, a clogged artery, a specific issue, I generally don't tell people to avoid coconuts, to avoid something that nature made whole. And so we have to just know when to apply the strict guidelines.
Yeah. I don't know whether we know that. I don't know whether we know that the rough composition of the coconut juice is like the blood serum.
It's like the blossom.
Just like the blood serum, blood without the red corpuscles. The composition of coconut juice is approximately like blood serum.
The serum, okay.
Yeah.
Mhm.
So actually, when people are short of blood, they can quickly be given coconut water, and things will be restored.
Coconut water, yeah.
Yeah.
But how is that different from coconut oil? Because they're two different things. Really.
No, I said coconut water.
Water, yeah.
But
coconut
I'm saying
water.
that is different from the coconut oil.
But
Yes,
you know,
I
that
know.
if
I'm
we
just speaking
talk
about the general usefulness of parts of coconut.
Thank you, sir.
So
Yeah.
one of the issues that comes up with the oils that are man-made, and we find, is that during the refining process, some of them become more pro-inflammatory than they are helpful when they're eaten. For example, the flesh of the coconut, or the
Absolutely.
coconut juice made with rice and whole, things like that. We have that tradition in Haiti, for example, of cooking with the coconut and the oiling, the making seeds and certain fruits into oil sometimes can lead to pro-inflammatory components of the oil. But I think coconut oil is one of the less inflammatory ones that we have. It's essentially the saturation. That's the only thing that is usually pointed at, but it's not all bad.
Yeah.
Thank you so much for that wisdom that you impacted in us. So we have tonight, believe it or not, our very own Jennifer Jones in our midst. I am going to look for her. I saw her coming in. She's knocking. She didn't think I saw her. There we go. Jennifer, please unmute.
Good night, everyone. How are you? To the Medical Mondays family.
Hi, Jennifer.
I
We
am
are blessed and favored.
Amen. Amen. So our very own Jennifer, so nice to see her on the platform. So are there any other questions?
May I just add something? That I didn't mean to downplay the value and the joy of coconut, but when we take it out of, as Dr. Ashby just pointed out, when we take it out of its natural context in terms of where it's used, West African, etc., and we bring it to the States, we cook it, we refine it, we put it in the sun, we do everything that shouldn't be done to it, and expect it to do what it's been doing in the West African coast. A very good analogy is when we heard about red wine being good for the heart, everybody ran out at lunchtime and made sure they had 2 big glasses of red wine as they were working. So we take things out of context. And it's a wonderful product, but it needs to be in context when we value. It is an extraordinary, wonderful item. And unfortunately, when it comes over the sea, we tend to do things to it which loses its extraordinary value. So thank you, Doctor, for bringing that forward. I appreciate that because it is a good item, and I do agree with it wholeheartedly in terms of use, but not here. If I was home in West Africa, I'd be fine.
Yeah, that comment is good. Mm-hmm.
And
Thank
you know, you're absolutely right. You forgot one more. They made MCT oil out of the coconut oil. I still am trying to figure that out. And I used to eat that so much that, you're right. Thank you. Thank you for that addition. There's another question here, Dr. Ashby. What are your thoughts on alkaline water?
Yeah, the alkaline water, again, has come out of the research that shows the alkalinity in the body is a state of health. A lot of times when we eat certain foods like red meats, a lot of those foods are acidic. A lot of times when we have health in the body and they measure alkalinity of those people compared to obese patients, for example, they're more alkalotic. So in general, there's been a lot of data from the literature suggesting that alkalinity is something of value. And of course, we're gonna make water. Same industrialization that we're talking about in terms of convenience foods being refined and then being dangerous. Now, alkaline water has not been shown to be dangerous in any way, but you can get your body to be alkaline just from breathing exercises. Briefly mentioned Wim Hof is an example of someone who provides techniques that can help you get your body pH a little bit higher. So alkaline water may do the same transiently, but it's again one more option that we have here in a small way to help with health. Is it going to reverse chronic conditions? If the basic pillars aren't done, probably not. But I would say it's an important thing first to have good water, and then alkalinity is important in general, whether you get it from water, from meditation, or from an alkaline diet.
Thank you so much. So this is the point where we actually announce our VIP winners or champions. That's people who bring more than 10 people or invite more than 10 people to Medical Mondays, get to become a VIP. And if you invite over 20 and they attend, then you become a champion. Well, tonight, we're doing a twist. I want to ask if anyone knows how many sessions of Medical Mondays with Dr. O we have had so far. And if you know the answer, please unmute yourself and say, or put it in the chat box. You have only 30 seconds to answer the question. Otherwise, nobody wins the Amazon card this week.
What's the question again?
25.
How many? Close. That was close. How many sessions of Medical Mondays have we had so far?
You started April 18th, right?
No.
20.
No, that was close. If I tell you, then when we started, I'll give away the answer.
We started in March.
That's March. Do we get a prize?
Those
Yes,
are
you
my
get a
clients anymore.
You get a prize. You get an Amazon gift card. And you know what? I see 28 in the chat box, 26, close.
I said 25, but you said.
That is close. JB,
Somebody wants to
you
say
are so close.
27.
Yes, 27.
Oh my God.
27. Let me tell you, we started March 1st.
Yes, but somebody was still talking.
27. I just heard about it.
So I'm gonna get an award. Yeah.
Okay, now. No, you said 25 consistently.
No, that was me. That was me. I was separate.
Okay. We started March 1st, and we've had Medical Mondays every Monday, except for, does anybody remember the holiday that we did not have Medical Mondays? I think Ephraim said July 4th. Yes, July 5th, we did not meet. So it should have been 28. This should have been the 28th episode, but it's 27. So Dr. Cap won that in the chat box. Am I right?
I think we missed the session, so it's 26 still.
We missed only one. It's 27. Sorry. So the Amazon gift card today goes to Dr. Cap. Mr. Bill, we give awards every Monday. We give a gift, but this is the first time that I asked the question in order to give that gift out. And I asked some questions today. Is the length of Medical Mondays adequate? 92% said yes. 7% said no. What will you consider adequate time? 1 hour, 1 hour, 30 minutes, 40 is about the same.
I
2
would say
hours.
1 hour and a half to 2 hours, at least.
At least.
At least, yes.
Oh, wow.
Now, the question is whether Dr. Ashby can talk that long, because I know she's tired and,
Well, I try, I don't know, but like you saw, the discussion is usually where it's at, and the content, you saw that you couldn't go into a lot of detail. You ask questions.
I understand.
Yeah.
See,
I think 1 hour presentation and then probably an hour question is fine, or 30 minutes, 45 minutes question is fine.
Wow, you're rushing. 1 hour presentation, that'll be long. See, the way we've noticed that the questions actually drive the heart of the audience, what you want to know, what you want to find out.
Yeah.
And that's what we want. We want to meet you where you are and not just give you what we think you want to know. And
Absolutely.
so that's why we give more time to the questions, as Dr. Ashby said. And, a presentation, I think, was just perfect. The timing, the length of time she gave to it, and the time to the questions, I think, was just perfect. And thank you so much for participating and for voicing your opinion and how you want us to continue. Some people have been asking to have real life interviews. Like, we have women who have lived in situation of abuse, and they want to come on the platform to come talk about it and come share their experiences and gain some wisdom. So that was why we asked the third question, to see if it's something that people on Medical Mondays would like. And if you like particular topics and all, email us. You get email reminders every week. If you've attended Medical Mondays once, you will get email reminders. Email us to suggest topics or something that is really on your heart that you want discussed. And by the grace of God, we will meet that need and bring you the expert in that field to talk about it. As you know, we are not establishing medical relationship. We are not establishing doctor-patient relationship with you. We just bring in current, authentic, the best information you can get anywhere to you, where you are, and giving you the opportunity to interact, to ask your questions and get your questions answered. And I just want to, recognize some more people here. Dr. Pastor Ogundipe. He is an amazing teacher. I'm wondering how we can fit that into Medical Mondays, because our spirituality is our health also. So Pastor Dr. Ogundipe, can you please unmute and just say hello to us? And then Commissioner Duile, be ready, because I'm going to tell on you. I'm going to tell on you on the new things you are doing in Maryland. So Pastor Dr. Ogundipe.
Well, good evening, everyone. Thank you, Dr. Ashby. Thank you, Dr. O. Thank you for the forum. God bless you all.
Thank you.
Thank you, Doctor.
Thank you. Commissioner Remi Duile.
Good evening.
Thank you. Can you please say, we asking that everyone who is able should come up and out to represent us. She has done so much in the community, presently a commissioner, and I'm going to let her tell you our next step.
Good evening, everyone. Thank you so much, Dr. Ashby. What a brilliant presentation. I took a couple of nuggets and I'm going to be a better eater and healthier eater. Thank you so much. And Dr. O, thanks for this great platform. I'm Remidu Yule based here in Maryland. I am running for a seat as a delegate in District 23B in my state, Maryland, which is the Upper Marlboro, Bowie area. And we launched about a week and a half ago, and happy to report that the state attorney for the county has publicly endorsed us. So we are looking to go and represent each and every one of you in that district in Annapolis. Keep us in your prayers, support us with your words, your kindness, and just whatever the Lord lays upon your heart. We are going to serve the people, and this is God's assignment, and He will do it. Amen.
Amen. Congratulations. And Marylanders, you know, contact us, because there are many ways you can assist Commissioner Doyle. Not only that, you can also do phone banking, and even if you're out of state, you can do that. So everybody, hands on deck, all hands on deck, you know, so she can continue to represent us the awesome way she has been representing us. So there are so many other people here tonight that we can recognize. I would say thank you to everybody, but in the sake of time, I want to ask Dr. Ashby to give us a closing remarks. What you would like us to take home.
You know, it's almost too easy. I thought about this topic and the fact that it's the #1 killer, and it's mostly food driven, and it really speaks to the collective food poisoning that's happening. You know, it happens very slowly. So regaining an ounce of consciousness, if you're in your 30s or 40s, thinking about promoting and reversing health, and asking yourself whether that bottom pyramid looks like water and then whole grains and legumes in the day would be my start. I ask myself that as I prepare for next week and think about a meal plan. What are those 2 or 3 meals a day going to look like? Because if you don't have a plan, you know you're going to reach for the inflammatory stuff, because stress and cortisol usually ask for sugar and refined carbs. So it's simple as always, but when you don't prepare and plan for it and make it a priority, it's easy to lose. It's very simple, but it's very easy to lose. So we have those opportunities every day, and we know the solutions a lot of times. So I would just encourage you to start taking moments and think about in this day, in this moment, how am I going to make a conscious action or effort towards promoting health? Because if we don't spend the time and energy, we have to invest that time and energy. Otherwise, it gets taken away from us when we have to attend to illness. And too many people, 600,000 a year, just die. Double the COVID rate, and every other person you know probably has a degree of heart disease. So it's worth taking a shot at with something as simple as nutrition.
Thank you so, so much, Dr. Ashby. And I'm so happy that my children are on tonight, as they are most of the time. Obafemi is on, Akinbi is on, Abiola is on, One Day is on. I am so excited that they're on and they heard you tonight. Thank you so much. And we're looking forward to your next time. You know, I'm going to be calling you tonight to ask you next day. You know, I'm going to do that.
Absolutely. I'm happy to. And, you know, I see that some people would like a more in-depth talk. While it won't be an hour, I'm happy to go in more detail and issues that matter to you guys.
Thank you, Dr. Ashby. Do you take patients from Maryland?
I do consult, but obviously I have to work with your doctor locally, and I can give some recommendations and I can help them facilitate the testing. I actually encourage other young and upcoming doctors to take this up in their practice. I help guide them towards where they can do the training for interpreting them. And so yeah, definitely, I'm happy to help in any way possible. I'll make sure you get the help you need. And like I said, the entire country has access to these advanced testing, and working with your local provider, as I do here, I work with primary care physicians who aren't necessarily doing that, but they appreciate when their patients are getting better and sent back to them.
Thank you. We appreciate you. And thank you, Dr. Pesami.
You're welcome. And
this is Shola Badimosi. I got it 27.
Shola, my sister. Oh my God.
I was the one that got that number. So you owe me big time. I've already sent you a text.
Okay, you'll get the Amazon gift card.
But thank you for doing this. This is great.
So I'll get you Dr. Ashby's number, because she does consult, you know, and yeah. And like I said, I have consulted with her myself. I am impressed. My health is going to be better. Ooh. So thank you so much. If everybody would please unmute, and let's give Dr. Ashby just, you know, a warm thank you. That would be great. Kindly unmute.
Thank you, Dr. Ashby.
Thank you, Dr. Ashby.
Thank you.
Thank you.
Thank you.
Dr. Ashby.
Thank you.
Thank you.
Thank
you.
Thank you.
And thank you, everyone. See you next week. Again, email me if you have special topics or anything you are interested in discussing, and we'll make it happen. Have a blessed week and stay safe.
Thank you so much, Dr.
You
O.
too.
Thank you so much, Dr. O.
Thank you.
to
Good
everyone.
night, Dr. O. Thank you.
Appreciate you.
God bless you.